Namaste, Vidya. Hamisha Khushro Vidya. Very good morning to you all. Myself, JV'n Dr. Ravi, Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in Jyoti Vidyapeeth Women's University, Jain. In today's lecture, we are going to discuss about the clinical examination of percussion signs of ascites in the gastrointestinal system. Ascites is the abdominal build-up of fluid in the abdomen, more than 25 ml of fluid in the peritoneal cavity. The symptoms include increased abdominal size, increased weight, abdominal discomfort, and shortness of breath. The complications of ascites includes spontaneous bacterial peritonitis. Now, how will you perform the examination of ascites? Ascites can be elicited by doing the percussion. The signs of ascites that could be percussed includes shifting dullness, fluid thrill, horseshoe-shaped dullness, and Pudal sign. We are going to discuss them one by one. Now, how to elicit shifting dullness? To elicit the shifting dullness, ask the patient to lie supine. Then percuss from the center outwards towards one of the flank. Say right flank, keeping the fingers in the longitudinal axis until dullness is detected. Normally, the dullness is detected over the lateral abdominal musculature while the flanks are dull in ascites. Then, keeping the hand on the abdomen, ask the patient to roll away from you onto the left side. Percuss again in the new position. If the previously dull node has now become resonant, then ascitic fluid is probably present. To confirm its presence, repeat the maneuver on the left side of abdomen. This is how shifting dullness is elicited. You can see the area of shifting dullness with the movement of the patient. The second one is the fluid thrill. Ask the patient or the attendant to put the edge or side of the hand in the midline of the abdomen and press firmly. This pressure will stop the transmission of waves or thrill through the fat in the abdominal wall. Place your one hand flat in one of the flank to detect the impulse while you tap or flick the opposite flank with your other hand for an impulse or thrill which will be transmitted to the receiving fluid if the fluid is present. This is how you can elicit fluid thrill in the patient of ascites. The third examination is the horseshoe-shaped dullness. Test can be diagnosed with 1 liter of fluid. This is seen in moderate ascites. The abdomen is percussed in various directions from umbilicus outwards. The area of dullness appears horseshoe-shaped with a concave upper border. This can be demonstrated in ascites by mapping out the dullness from the umbilicus outwards in different directions. This is the shape of a horseshoe. You can see this horseshoe appearance due to the dullness and pimping in the case of ascites. The next sign is the Pudal sign. Pudal sign is the dullness in the knee-elbow position. Here, the patient is asked to sit in the knee-elbow position, and due to the gravity, the fluid accumulates in the center of abdomen. The center of abdomen is percussed as the patient adopts a knee-elbow position. The fluid collects, gravitates in the center in this position, making it dull on percussion. This is the Pudal sign. This is how you can elicit the Pudal sign in case of ascites. Due to gravity, the fluid will be accumulated here, and then you can percuss to get the dullness in the abdomen. So this was all about the various signs to elicit the dullness in case of ascites. In the next lecture, we will be demonstrating how to do the percussion for splenic dullness. This session was powered by Digital Version 2.0, Jyoti Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.